Okay, welcome back to the Founders Table. Today I'm joined by Wayne Gillis, President and CEO of Rehoboth McKinley Christian Healthcare Services, where he's leading a powerful turnaround of the hospital system and strengthening its role in serving the Gallup, New Mexico community. Wayne has an extensive background in healthcare leadership from, this is a lot, restructuring major hospital systems, boosting performances across operations, growth, and expanding service lines to driving double-digit EBITDA, which for my non-finance people are essentially earnings before interest, taxes, depreciation, and amortization. He's someone who thrives in high-pressure, complex environments. His career has been about creating visibility, structure, people-first leadership that makes a measurable difference for patients and communities. So I know today's conversation is going to be amazing. Wayne, thank you for coming on. My first question to start things off, you've built a career leading hospitals and healthcare systems through growth and transformation. What first drew you to healthcare leadership?
That's a great question. And thank you for having me on today. So I'm super excited to be on. I think for me, as I was a nurse first. And so as a critical care nurse, you establish all these relationships. It's very intimate with the patient and the family, and you have a close relationship with the providers. And so I love to make an impact. And so where as I continue to kind of grow in my career clinically, I guess I had some natural leadership, abilities, and I could really have the ability to be broader and have a bigger impact over a larger scale than just one patient at a time, which was very fulfilling for me. And so it's making a difference. And I feel like that healthcare is so pivotal and personal and requires high level of ethics, and we can do it so much better than way we have done it in the past. And so learning from all those mistakes and opportunities, it really opens the door for a lot of transformation. And so it just kind of organically kind of happened is really probably the best. That's not a short answer, but
No, I love that.
it's how I feel.
No, I love that, man. Was there this kind of spontaneous question? Because most people, when they feel like when they go into leadership, sometimes there's maybe like either a leader that kind of influences them or a defining moment in your career where that made you want to go into leadership in general. Do you have one of those?
I have two actually.
Okay.
So, the leader that was over me when I was in the critical care unit was a mentor, and as she kind of got promoted, I kind of followed her. I kind of would go into her seat, et cetera. And so I spent 16 years at that hospital and really kind of grew from a clinician into a leader. And, she's still a mentor today. So it was an incredible human being. And to me showed me she's definitely really what I would consider a fine example of servant leadership and what that should look like and how you should demonstrate that. The second one, and the reason why I want to bring both of them up, because I saw myself, as a nurse leader, and then I started to want to get into more on the operations side. And so I had kind of attained in my head that I wanted to be a chief operating officer. And that was where I was going to stay. That was going to be kind of my ceiling. And
Mhm.
so the next CEO that I worked for when I was in VP roles, he saw, you know, leadership abilities in me that was larger than COO. And then he felt like that I would be a great CEO. And so worked for him for about 4 years and really grew under his leadership. One of the biggest things I think for me personally was that I recognized that, for me, I wanted to be broad. I wanted to have the ability to look at situations, not just clinical, not just from a pure financial standpoint, but from a departmental standpoint, because all those departments roll up into a large organization or health system. And I
Mhm.
wanted to be able to lead and mentor that and understand when those things were off and that they needed to be pulled back into the middle of the road. And so I spent a lot of time, honestly, expanding my knowledge and experience before I ever actually stepped into the CEO role. So I would be able to look through multiple lenses, not just one or two.
Love that. And then my next question after that was actually, was there a defining moment in your career that made you realize you wanted to take on the CEO level challenges? But I feel like you just answered that unless there's something else involved in there.
No, the only thing that I would probably add to that was I got to step in right after that mentor that told me. I got to step into the interim CEO role, and I was in it for about 8 months.
Wow.
And that was my defining moment that I realized I wasn't quite ready yet to perform in the way that I wanted to perform. And so it helped me recognize there were a couple of gaps that I still had. And so I pursued filling those gaps in before I actually pursued, actually taking the role permanently.
Man, I love that because it's such self-reflection, which I think
Yeah.
is very important, especially when you go into leadership roles.
Yep.
One thing you touched on with your past mentor on, you mentioned that she was the true definition of servant leadership. And I think I'm big on, we'll get into this a little later on, but I'm big on workforce. I'm big on, the people make the company. And I
Yep.
think servant leadership is a definite thing that a lot of companies are realizing that is the right way to lead teams. So I'd love to get into that a little bit later on. Um,
Yes.
but for those of you, for people watching that may not be familiar with Rehoboth McKinley and the communities you guys serve, can you kind of give some context?
Yeah, absolutely. So we're in kind of on the west northwest part of New Mexico.
Hmm.
There is a massive native population here. So probably the biggest is the Navajo Nation. There's about 400,000 people
Wow.
that are in the Navajo Nation. And so that is probably about three-quarters kind of surrounding McKinley County, which is where Gallup is. And then we have the Zuni Nation is another large nation. So when we look at our population that we serve in the hospital itself, probably between 62 to 65% is Native
Wow.
Americans. And then my staff, I have 52% of my staff are Native American. And so, which is awesome because, right,
Yeah.
we have that kind of collaboration and connection. And that has been a great learning experience for me because I've had work with some, but never with this much concentration, right, in the whole community. And so it's very underserved. When we look at the reservation, there are still people that don't have power, don't have running
Wow.
water. And so that brings a whole new level of complexity for patients that come in and get procedures, have surgeries, and then get discharged, like a diabetic that needs refrigeration for their insulin, right?
Right.
You have to think differently and you have to kind of make sure you're connecting the right resources. And so I think in a good way, it's kind of forced us to think outside the hospital, outside the discharge process and make sure that we are continuing to look how do we partner with the community in different ways because healthcare extends past the hospital, right? And
Hmm.
if we can't make sure we have the right support outside, then we're going to have those people flip back in, right? Because they're not going to be able to make their full recovery.
Makes sense. And this kind of leads into my next question. Since stepping in as CEO, I was gonna ask like what was your single biggest priority, but I feel like in healthcare there's always more than one priority, right? So what are the biggest priorities for you and like your leadership since you've stepped into CEO?
Here is different than my last CEO job.
Hmm.
And part of it was this was a very, very, very distressed asset when I stepped in. So we had a large amount of debt. We didn't have enough revenue to match expenses and bad reputation because there frankly had been a lot of I, leaders that maybe weren't focused on the right stuff. So
Hmm.
I'll just put it that way. It's been a lot of changeover in leadership here. And so that was probably my biggest first priority was to figure out how to get rid of the debt because we already didn't have enough revenue to make payments on debt, made it even worse, right? So we had no cash on hand, zero, not
Wow.
$1. And I had $17 million worth of debt.
Oh my
And I
gosh.
stepped in November of last year. So in April, we paid all the debt off. And
Wow.
so that was a huge, huge accomplishment for us and super exciting. And then when we think about the cash on hand, and I don't know if you're familiar, but just like in our personal finance related to kind of credit scores and all that kind of stuff, right? Kind of hospitals or businesses are kind of ABC.
Hmm.
Right? You have a triple A, you're great, you're the top credit kind of
Yep.
credit score, if you will. And so one of the indicators for hospitals to say, hey, you're stable, at least from viewing from a creditor standpoint, is days cash on hand.
Okay.
And so the first kind of milestone is to have 100 days cash on hand, and then
Okay.
of course go up from that. And so that's kind of that first threshold. And so we're at 99 days today. So we went from
Wow.
0 in November to 99 days today. And so I feel like in the next few weeks, we'll kind of top over into 100.
Hmm.
But that's been a huge amount of work for the team with a
Yeah.
whole bunch of different strategies for us to accomplish those things. But it's been exciting because staff, everybody has embraced it, but they embraced it honestly, Tony, because you have to be transparent. You have
Hmm.
to give the reason why. Yeah, and you have to. Sometimes we give information and we give it because it makes sense to us, but we got to think about our audience, and sometimes it has to be different, right? It has to be delivered differently and in different formats for everybody to understand it and get their arms around it. And so I think that's one of the biggest reasons why we've been successful is we're comfortable in our own skin. We're comfortable about being transparent, and people haven't pushed back. They've engaged.
Right. And one thing I'd love to like get clarification on for people listening, because I'm sure anybody listening, they're hearing $17 million in debt, and they're like, they're like, I got $2,000 in debt. Like how'd you get rid of 17? So, but obviously on a business sense, it's different. I guess for people who obviously they're not in the position that you are, they don't know a lot of things that you have gotten the privilege to go through and learn from. What's like, without explaining the process, but like, I guess what's your first point of action when it came to like, okay, how do we get this debt down?
It wasn't a quick process for me. So, and the reason why it kind of ties back into what I
Hmm.
was saying initially about how I wanted to make sure that I was broad and
Hmm.
that I could, right? I don't know. I can't be a revenue cycle director, right? I can't be a pharmacist, I can't be a lab director. So, but I understand and I've taken enough time to be able to understand how they operate, how the business operate, what drives it. And so I have the ability to see when things are off, right?
Hmm.
When things don't make sense. But so it took a lot of time, honestly, the first probably 5, 6 weeks, meeting with directors, being in their departments, sitting with frontline staff so I could watch the processes. And I
Hmm.
needed to understand how the organization is functioning because all these people, all these places, departments connect, right?
Right.
They connect into one large organism, and that either works well or it doesn't work well. And so there was fractures all over the place, processes that didn't make sense, processes that didn't connect. And teams were just used to working with it. Wasn't that it frustrated them, but they didn't know how to fix it. Right.
Interesting.
And so started really engaging a grassroots effort of the directors and how they needed to change and augment and start to address issues that were causing us harm
Hmm.
both with an efficiency standpoint and from a financial standpoint. And so the money started to come in as we started fixing those things. But you can't do it global and you can't do
Right.
it from my office,
Right.
right? If I try to make those decisions, I'm going to miss the mark every time because I'm not close enough to it. So I have to recognize that and I have to
Right.
engage the right people that are close enough and together we can figure out what the right solution is.
Man, I love that because I think what you've pretty much just told a lot of leaders, like listening, or anyone who listens to it, is that if you really want to, as a leader, if you really want to help solve problems, you have to go inside the organization.
You do.
You can't place people all the time just to try and figure it out. You have to go into it.
Nope.
I
Yep,
love that,
you
man.
can at
That's a
all.
great piece of advice. You've reestablished critical programs, improved financials, strengthened community engagement. And obviously you told us about, the $17 million debt thing that you
Yeah.
guys went through as well. I was going to ask, what are you most proud of so far? My assumption is the $17 million debt, but I feel like there's something else as well.
Yeah. I'm excited about that, right?
Hmm.
What I'm most proud of is the team.
Hmm.
Honestly, just because you think about, and this is the reason why I need to go back in time a little bit so you can understand the relevance. So, about 18 months before I came, that they were considering closing because they had $34 million in debt.
Hmm.
And it was just really a bad time, right? The community was upset as they were because this is their hospital, right? It's been here since the 60s. And the county and the state, ended up actually covering $15 million was what came out of that and kind of kept them from closing.
Hmm.
But when you think about leaders and you think about individual team members, not knowing at that time, are they going to get a paycheck in 2 weeks? Are they not going to get a paycheck? Are they going to come in and tell us that the place is closing, we don't have jobs? That creates a certain mindset, right?
Hmm.
That is very head down, not really engaging, thinking about growth. How do we make things better? What do we do with continuous improvement, right? All those are healthy pieces of an organization. And so I came into that with, we were in a, we were halfway there from the debt standpoint, but we still had all these broken things. And we had a whole leadership group that really just kept their head down. And it
Wow.
has, been so exciting for me to really pull their gifts and their talents and start to build their positive confidence where they're the CEOs of their departments. They know what to do. They know
Hmm.
how to build business. It's in their head. I just had to start to elicit to give them comfort and permission to be able to start to actually take chances, take
Right.
risks, kind of really venture out, think big. And that transformation has been mind blowing for me from when I started and how, I had very little engagement to now they're driving things. They're coming to
Right.
me with their ideas. I mean, it's been a significant transformation, which has been exciting.
I love that, man. And it's like, I feel like in any business, and even as you talk about healthcare and everything, it's way more prevalent in the healthcare system, is you need a
Yes.
team that is very engaged, feels appreciated, and especially when you think about it in healthcare, because these are the people that are quite literally treating people,
They
and
are. It's
you
true.
don't want a negative environment. So
No.
that's very, very, that's an insane account. I can see why you're proud of that one
Yeah.
as a most. Um, for like strategy and transformation, I mean, like, how would you approach the turning around like a healthcare system, while keeping like quality care front and center, Does that make sense?
Yeah, it absolutely does. So one of the things that I started here was, when I think when you're going on a transformation journey and you've got, you're rebuilding, right? This is a big turnaround project, and the finances are absolutely important, right? And so you want to make sure that you can start to pay your bills and all those things, right? That's vitally important. But you can't you cannot sacrifice all the other pillars. So when you think about the people pillar, when you think about kind of delivery, which sometimes we forget about finance because they're actually tied together. If you have efficient delivery, you're going to have better finances, right? Then you think about quality and safety.
Hmm.
Those in healthcare, well, in any business, but definitely in healthcare, right? They have to be front and center. And so for me, all that has to be very visible, right? We have to be measuring things that are based on national standards, and we need to be looking at that every single day. They weren't used to any of that. And so we ended up, we have a big, huge board that has metrics from all over the hospital. Actually, I took a wall and painted it with magnetic paint. And I mean, it's literally about 16 feet long. And
Wow.
we've got probably 60 measures on there that they come in and put. So we have a huddle in the morning, 9 o'clock. All the leaders come in and they actually go up there to the board and they actually mark where they were in the last 24 hours. And so we go through that. I lead the huddle
Hmm.
and we talk about, all the measures that we're measuring for the last 24 hours. The goal is absolutely celebrate the wins, but we really are trying to call out it's abnormality escalation. We
Okay.
want to be able to see something that is not going in the direction we want it to go because I want to fix it in 24 hours, not fix it in 30 days. Typically, when we look at a lot of dashboards or a lot of quality measures, we're looking at something that is 30 days old, but it's actually more than 30 days because it's usually a week after the month closes before you get the
Mm.
data. And so it's actually 5 weeks old. I can't fix that. That
Right.
was 5 weeks before. I can fix something. I can't necessarily fix what happened the last 24 hours, but I can prevent it from happening in the next 24 hours, right?
Hmm.
And it allows us to be able to make these little changes that are not dramatic in the organization, but it improves and nobody really feels it, but we're making this dramatic improvement. And so I've got a big continuous improvement background, and so I like that kind of stuff because it engages the hearts and minds of the organization. And so this is a way that we have full transparency, problem solving that takes place, and we do this in 15 minutes every day.
Wow.
It's super efficient, super
Where
efficient.
and where is this something you came up with? Did you learn it from somebody or an
Um,
organization?
Yeah, I learned it from a lady that when I was working in Phoenix, and
Okay.
so I've brought it to this organization and then the previous organization because I love the way it engages everybody at the front line, and it goes
Hmm.
back to kind of those reasons when you're making decisions, you want to make sure you're engaging the right people.
Hmm.
And so this is a way to formally do that, so you can not lose track of it and you can actually make measurable progress.
Yeah, and there's especially on the time aspect of it, like how
Yeah.
quickly you guys can point something out. Because I feel like, especially at companies that are very large in scale, the biggest thing I always see happens is just the delay in making a change or the delay in fixing something. It always takes weeks, and you go back, you're like, well, why did it take weeks? Well, it took me a week to get this, and it took this person a week.
Yep.
So that's a great. I've never heard of that strategy, but I could see why it's been so effective for you guys.
Yeah. Yeah, and you because of bureaucracy, back to what you say, right?
Yeah.
It's good to have processes and policies, but you have to make sure that it meets the needs of the organization and that you don't have so much bureaucracy that you're just delaying things to delay things, right?
Hmm.
It doesn't make sense to do that in many cases, and you don't have to.
Yeah, no, I 100% agree. For healthcare leaders, facing, or what I feel like healthcare leaders do is they, you're facing or you're competing against priorities daily, right? So you have patient outcomes, you have financial sustainability, staff retention. How do you balance, or how do you go about balancing all three without losing focus?
I think you have to engage the whole organization. So just like I'm talking about what we do with the leaders,
Hmm.
we have that same process in every of the departments.
Okay.
And so, and in many of the departments, we have frontline staff leading the huddle because they're
Wow.
measuring things that are important to them, that are important to their department, right? And those things then connect to the organization, which then connects to the strategic plan. And so,
Okay.
how you move things and keep it all balanced is it has to be visible. We have to talk about real issues, right? We have to measure real things. And when it's not working, we have to honor the reality and say, hey, we got to do something different, right? But that's not punitive, that's not uncomfortable, right? You have to create that environment. It doesn't
Hmm.
just naturally happen, but that is the way that you can drive those things because even the director, it's one of the things when we think about old traditional leadership, we had to have all the answers as a director, as a manager, blah, blah, blah. Somebody asked me a question, I've got to always know the answer. Well, no, you don't, because you're not going to always know the answer. That's why you have a team, right?
Hmm.
Your whole team together as a team with all your employees, you can come up with the answer every
Yeah.
single time. You can come up with the right solution every single time. But that traditional leadership where they have to, be the end all designer and leader of everything, it's just not an efficient model. You need to engage the people that are on the front lines because they know where the holes are.
Yeah.
We know the big holes. We don't know
Hmm.
where the small holes, and sometimes the small holes are just as significant as the big holes.
I love that, man, and it's so true because I remember back in my day when I was working at smaller like retail stores or things like that, and there
Yeah,
was always a thing you would always hear it every day now. It's like, well, leadership doesn't listen to what we tell them the problems are at the front,
true.
and that is so true because, like you said, you have the big holes, but these small holes you're still gonna have a leak.
Yeah,
A hole's still gonna leak water at the end of the day.
yep, absolutely.
So I feel like this led into my next question as well, and I 100% know your answer for this, but I'm going to ask it anyway. Uh, a hospital system, obviously, of your size requires very strong teams, right?
Yep.
So, how important has team building and what I do want to emphasize as well, too, encouraging leadership development been to your success within your teams?
Vital. In fact, that's one of the things that, oh gosh, probably working with my VP of HR, that her and I kind of said, we have got to develop leaders, right? Because we had leaders. Sometimes people get promoted because they're smart, they're strong workers, they have a great attitude, right? But we don't give them tools.
Mm.
You're like, it's kind of like putting pixie dust on them. Boom, now you're the leader, right? It doesn't work like that. To develop into being a really good, strong healthcare leader, you have to have experience, you have to have mentorship, you have to have knowledge, you have to have tools in your toolbox. And so we started, I think in February. So I came here in November. We started in February. We do Leadership Development Day every single month. And we planned out the whole year because I wanted to escalate it. And
Hmm.
then we're going to do the same thing next year, but we're building on that. So like next year, we're going to start getting heavy into finance and accounting and really helping them understand their budgets.
Hmm.
But this year, we've been really looking, it's been about team building amongst themselves, how they can collaborate with each other, but how do they engage their teams and how do they leverage their teams? How do they leverage themselves across the organization from a collaborative standpoint? And so that has been super exciting for us because we're really seeing a lot of leaders really, really grow. And so that's been really cool to watch that kind of evolve in front of us.
I love that, man. And teams are so strong. Like you need it's like every business knows this. So you have to have a strong team. And I feel
Yep.
like people, because just how you said, like your decisions are made within the team. You can go to your team and you can find a decision to a problem. But I feel like what has potentially been the issue a lot of times, whether it's in healthcare and businesses, is sometimes people are part of a team, but they don't feel valued as part of the
You're
team.
right.
Therefore, your team has a hole in it.
Yep, that's true. You're absolutely right.
So, but for healthcare, and correct me if I'm wrong, I feel like retention and culture are typically like ongoing challenges in healthcare. If that has been a thing, what strategies have you found most effective for keeping staff motivated, supported, engaged, making sure they feel valued?
I think it's a balance. I think there's a balance from this perspective of we got to make sure we have fair pay, right?
Mm-hmm.
And that we're honest and open and transparent about that. And so that you have to make sure you're doing that in internal equity, all those different things. So from that standpoint, I think as you continue to evolve, that needs to stay on the front of the agenda
Mm-hmm.
because when we start performing better, the organization performs better, there should be benefit back to all the employees. And we have to figure out how do we make those connections. So I think that's one thing. I think the second thing is, when we have to have a culture of, honesty and transparency, and that we will say when we've screwed up, right?
Mm-hmm.
When we've made a mistake, we're willing to say that publicly. You know what? This wasn't a good decision. I messed that up. This is what I'm going to learn from it. And so it links right in with the safety culture. Healthcare and safety, what we used to have, and I've been a nurse for a long time. And when I was first a nurse, the first few years, you made a mistake, it was very punitive. And so when you create that environment, people don't say when they make a mistake. They hide it, right?
Mm-hmm.
And the bad thing of that, one, it's bad that they're going to beat themselves up, they're going to hide it, etc. But the bigger thing is that there is missed learning opportunities that the organization can learn from why did that mistake happen? Because
Mm-hmm.
the majority of the time, it's not the person. They're not trying to make a mistake. It's usually a process or a piece of equipment that has failed them.
Right.
And so most of the time it's process. And so if we don't address the process issue, we're setting the rest of the team up to do the same thing. They're not
Mm-hmm.
unique. And so, going on the safety culture where it's not punitive anymore, where we celebrate people bringing up that they made a mistake so we can have cascaded learning from that mistake, which seems weird, but because we don't want to make a whole bunch of mistakes, but we are human, right? We are going to make them, but we need to try to figure out how can we impact the future patients, right? And so if we don't learn from that, we're not going to have an impact on the future patients.
That makes sense, 100%. And for like retention wise, I mean, do you notice a lot of retention in healthcare as far as maybe people changing careers or maybe I'm not too familiar with the industry.
Yeah, I think it's twofold. One, I think you have to have a great culture, but
Hmm.
part of that is you've got to make sure that when you get a new person in, that they're really you're very intentional about making sure that their orientation was solid and that they got what they needed to then be successful.
Gotcha.
The largest majority of turnover usually happens within the first 6 months. And if it does, the majority of that has been orientation related,
Hmm.
that they just don't feel satisfied or feel prepared. And so it disillusions them. The second piece, I think, is it's really about as we start to improve things, which goes back to kind of the continuous improvement and having the departments measuring things. A lot of things that drive people to leave is that things don't change and they
Mhm.
stay the same. And they're, why are we doing this stupid process that I have to do 25 steps and I could do it in five,
Yeah.
right? It frustrates because they're doing that every day, sometimes multiple times in a day. Right.
Hmm.
And if you don't have a process and a way to be able to address those things, you just grind people down, right? And you have a certain of attrition that is really attributed to that as well.
Yeah, and then on that note, I mean, the time it takes for, I think, to make changes as well, even though it's different than when a leadership team tells you change is coming, but then
Yeah.
it's been a year. I've been in past sales organizations in the past, and there was always, it's very prevalent in sales organizations a lot, where it's like, that like this change is coming, this change is coming, and then everyone waits around for like a year or two and nothing ever happens. And then
Yeah, you're
I
right.
think that causes a huge retention.
It does. It does. I completely agree with you.
And like, for you guys, when you talked about the orientation, that was like a and how you said like most people leave in the first 6 months and most of it's tied to the orientation. I feel like a lot of companies they realize it, but maybe they're not acknowledging it as just how expensive, especially hiring is, like and bringing on people. So if you're having such a high retention rate like that, people leaving or high churn, that's costing. That's this areas of like when, especially I feel like when you go into the financial aspect of it, and when you're trying to better your finances, that's an area that is I don't want to say easy to fix, but should be your first point of contact because it's going to flow over into the other areas as well.
Right. I think one of the things that, a lot of companies and we all, you have pressures and you want to make decisions and there's a confusion I think about when you say about lean.
Mm-hmm.
I'm going to go lean versus the meaning of lean as it relates to continuous improvement. Could lean could be just cost cutting versus looking at better processes and efficiency. So there's a difference there. But I think some of the biggest challenges for some people is trying to get their head around when we have orientation. I want to try to get that person on the floor as quick as I can or in the department, right? And that's not a bad thought
Mm-hmm.
if you can make sure that the things that you're covering really meet that individual's employees' needs to set them up for success in their department. And there's consistency and standardization, and we're making sure we're covering all the right things. And so, humongous, massive key of success for that is that you got the right disciplines having the right level of orientation. And that's one of the things that we've had to do differently here because we were cost conscious, right? We had all these financial issues. And so we were trying to push people through orientation as quick as we could. And we were leaving lots of holes and
Mm-hmm.
lots of gaps. And so that we've had to retool that whole process. And we're still evolving that as we're learning more.
Right.
Because there are some other departments that we thought we were hitting it. And now we're looking and saying, nope, we've got to really look at X, Y, and Z because that's missing in their orientation. And it's also not helping them perform smoothly in their department. And so we've got to be willing to like look at right what we're doing and be open and honest to say that's not working. And some people have a lot of pride and ego, right?
Mm-hmm.
And they design something and so it's going to be perfect and they're just not going to look at it again. And we can't do that. Right? We can't do that. We have to do the right thing for the organization regardless and put our ego aside.
I love that. I think you're preaching to a lot of people right now on just what it truly takes to be a good leader at the end of the day. And you kind of maybe this answered my next question, but again, I'm still going to ask it. What do you feel like is your biggest bottleneck when it comes to building teams that can scale with the needs of the organization?
That's a great question. I think probably for me here, it's getting better, but I was the one that knew the stuff, right?
Mm-hmm.
I've done this before. I was rolling, so it was like a one-man show, and my executive team is they're amazing and I absolutely love working with them. And they are like I'm starting to be able to hand some of that stuff off, right? And so once we get more people that feel more comfortable with how we drive some of this stuff and how we develop it and how we continue to nurture and kind of feed and water it, then our scale is going to continue to increase and get faster and faster. But initially, that was probably my biggest bottleneck because I knew this was going to connect to so many things that we needed to change related to the turnaround.
Right.
But I really couldn't hand it off initially, if,
Gotcha.
if that makes sense.
No, it does, and please correct me if I'm wrong, but it's like it's more so like the expelling of information to other people. Like it's like you know what to do a lot, but how do you get other people to understand that same process, right?
Yeah. Right. And you can't rush it. Right.
Right.
This is stuff that you want to make sure people really understand and are comfortable, and that they also know that some of these things take time. You have to let the process work the process, right?
Yeah.
You can't rush some things. And part of that in a learning journey for an organization, they have to take it in bite-sized pieces. I knew where I wanted to go, but I know that I had to take it, and there were only certain things I could roll out and only certain kind of metrics I could push because it was a lot for them, right? I
Right.
got to make sure it's manageable and they can wrap their head around it. They don't feel overwhelmed because then they're not learning.
Right. Makes sense. And first of all, Wayne, I just want to say like this has been an incredible podcast so
Oh,
far. I know
thanks.
everyone listening is getting a wealth of information. As we go up to the last few questions here, I have three more on
Okay.
challenges and like looking ahead. Um, if you had to point to one factor slowing down growth in healthcare systems, it could be specifically for Rehoboth, or it could be just maybe in general trend you see, whether it's workforce shortages, funding, infrastructure. What would you think it would be?
For us in New Mexico, I absolutely know what it would be. Right now, kind of the top of our list is malpractice coverage.
Okay.
When we think, and the reason why that's so big, one, it's expensive for the organization, but the bigger driver is it is deterring providers from coming into our state. And so that's a big deal. We don't have enough number of physicians to patient need. And
Mm,
so we don't need anything, hampering that. And so we are at a place where there's only one provider that provides malpractice insurance claims for the whole state. That is
wow.
not a good place to be.
No.
And the biggest driver behind that is our state, and I think there's one other state maybe in the nation that does not have a cap on punitive damages, and
Okay.
so they can just go as high as the lawyers want to make them. And so when you think about rural hospitals, that are not a part of a system, that are independent and are part of a community, getting a $400 million claim would there's no way to recover from that.
Yeah.
And we can't get insurance to even come close to even covering that. We have a cap.
Hmm.
And so that right now is a big risk. And with not having a cap, it also makes the state very primed, not in a good way,
Mm,
for attorneys to want to come in and do claims and people to want to actually submit claims. And
mm,
so that is also a risk for providers because whenever a claim, even if they were not found anywhere guilty in that, it's going to be tracked on their record. And that's
right.
a big deal, right? You don't want that on your record. And so those are hampering our ability to recruit and retain. We've lost four providers this past year in McKinley County, and all four of them, that was their primary reason for leaving. And so we have to address that.
And you quite literally have somehow segued into my next question. Again, you do a great job of that. Right?
Thanks.
Maybe there's other you can touch on other stuff as well too. But please, if it's the same one, please go ahead. I was going to talk about as you look into the future. So I mean, we're nearing the end of 2025, going into 2026, which
True.
is insane to say. Feels
Yeah.
like February just ended,
Yeah.
like last
Oh,
week.
I agree.
And we're going into a whole new year. What's the top priority for you guys? Is it the malpractice?
Malpractice is important probably for me to kind of take that on, right?
Mhm.
Not necessarily the organization. And there's a lot of work with the community, and I'm doing a lot of anytime I can talk about it and educate people to it because we got to put pressure on legislators, right,
Mhm.
at the state level. And so
Right.
that needs to be addressed. I think we've been pushing that hard this year, and so I think we're putting enough pressure that we're going to get some action on that. So that feels good. Still got to keep that kind of on the forefront. Really, the bigger thing for me behind that, aside from continuing to make sure that we're growing the right services and the services that we're providing, we're continuing to just get better and better and better at that, is really about the Medicaid. For us, we've got, there's some new requirements related to Medicaid that came down from the federal level. We can get past it, but it is going to
Mhm.
require us doing things differently. We're going to have to look at it differently. We're going to have to change processes. We're going to have to add some people to support the community so we can get them enrolled. And so that's a big population for us from a payment standpoint. And so if we were to all of a sudden lose a third of people that would all of a sudden become self-pay, and if they can meet Medicaid requirements, they're not going to be able to pay their bill. Right.
Mhm.
And so that just becomes bad debt for us. And so it is in our best interest to take a proactive approach to how we can better support the community through education and helping them stay covered.
Got it. And then, to be honest, man, that's a lot of stuff.
Yeah, it is, but it's doable. It's absolutely doable. So we just
100%.
you gotta take it one day at a time, right? That's
And
how
I feel like at your level too, which is why I like doing these a lot because people really get to see an inside perspective.
yeah,
They get to see kind of what is going on. Because for a lot of people, and especially people who maybe they want to try to be leaders, maybe they want to run a business, maybe they're just everyday people who are listening. When you don't see something happening, it's hard to envision how it happens. And a lot
sure.
of people see businesses, hospitals, and it stops at the doctor for them. It
Yeah,
stops at the whoever it just runs. Like there's no one
yeah,
run, but in reality, it's people running the
yeah.
business, running
It
the
is.
institution, and there's decisions that have to be made. And it's tough a lot of the times to make those
It is.
decisions. So I love you sharing your insight on this. As we go into the final question for this, and feel free after the final question, I'll close this out. But like, feel free to if you want to leave anything after that. If you want to plug your LinkedIn, whatever you want, feel free to go after that.
Okay.
For this question, for other leaders listening, what's one piece of advice you'd give them about leading through complexity and transformation?
It's a great question. I think first you have got to remain calm. And the reason why I say that is because it can be overwhelming, right? You've got these complex problems, especially if there's a lot of financial things tied to it. You have to, be calm because your brain works better when you're calm. You have to look at the situation comprehensively and don't make rush decisions. Don't throw band-aids on things. It may give you a little bit of relief, but eventually it's going to come back to bite you in the butt, and that's not going to help you. Take it piece by piece. Engage your people. Make sure, don't assume that you know what's right. You want to trust but verify, but you really want to be open, be humble, and really lead the organization, but you're leading it with your leaders together, right? It's a group thing. It's not a single person. No single person can accomplish all this stuff. It takes every single person in the organization for us to move the organization in the right direction.
Love that. I think that's a great way to end it off. Any do you for your social medias, things like that? Is it okay if I put your LinkedIn
Oh
and
yeah, sure,
channels one if they
absolutely.
want to just reach out? For
Yep,
everyone
please.
listening, that's how we got connected. LinkedIn.
Yes, it's
LinkedIn's a great
true.
platform.
It is.
So, Wayne, thank you for joining me today, sharing your story. It's been inspiring hearing about your leadership journey and the impact you're driving. For our listeners, I hope you enjoyed the episode and took away valuable lessons on leadership, transformation, and I think most importantly, the power of putting people first and respecting and appreciating your teams. Thank you again for tuning in, and we'll see you guys on the next episode.